All right, in this video, I'm just going to show you some of the equipment that's needed to do voluntary cough testing in a clinical situation. Typically, you need a peak flow meter. The peak flow meter is used to measure cough peak flow rate, so that's kind of the fastest velocity of airflow produced with the cough. Peak flow meters are typically single patient use. However, when you attach a respiratory filter to it, most institutions feel that the peak flow meter can then be used between patients if you dispose of the respiratory filter and then wash or sanitize the peak flow meter between patients. So you'll want a peak flow meter, you'll want a respiratory filter, and then you may or may not also want a face mask. When we cough, we can cough into a mouthpiece that goes through the mouth, so an intraoral mouthpiece. You can also have people cough using a face mask, which might be a little bit more natural, and so that's actually my preference. So the peak flow meter that I use is the one that's currently available on Amazon. It's by Omron. It looks like this. The reason why I like this has to do with the connection here. So whenever you're buying peak flow meters and you're using respiratory filters, you need to start to match the connection between the peak flow meter, the filter, and the face mask if you're using a face mask. And so I've kind of searched long and hard for various peak flow meters that connect to various connectors, and that's what I'm going to show you all right now. So this is the peak flow meter that I use. It comes with this white intraoral mouthpiece. So typically people would just cough into it or breathe into it like that. The filter I have looks like this. It's a respiratory bacteria filter, and this is the purchasing information. And then the face mask is a cushion face mask. So this is cushion to provide a good seal, and then this would be the ordering information for that. So for voluntary cough testing, what you'll actually do, you'll see that this that the white intraoral mouthpiece that comes with this peak flow meter is a little bit larger on one side and smaller on the other side. It's intended so that the bigger side goes in this end with the smaller side extending outward. But for this testing, what I actually want you to do is I want you to flip it the other way around. So the small end goes in first. It's going to seem like it doesn't connect all the way. Just push it in a little bit more, and then you'll feel it kind of catch into place. From there, you can take this respiratory bacteria filter, put the larger end of the filter, so there's a smaller end and a bigger end, put the bigger end around the mouthpiece, the intraoral mouthpiece, and so now we have a really nice tight seal with no air leakage. From here, you could have patients just cough into the peak flow meter like that. My preference is to actually use a face mask, which would then kind of connect on that side. So here, then someone could take a big breath in and cough like that, and then we see their peak flow rate. When coughing, only the greatest velocity is captured using this dial. So you want to reset it after every cough. They cough. We see it went up to here, so that's a reading of around 320, and then you'd reset it. We have these additional markers here that you can set with these different color schemes. And so if you're doing cough training, you might use these as various target ranges for therapy. Otherwise, you could just kind of keep them all down there. So this is the setup for voluntary cough testing.